right? And if you've got enough work to keep an entire team, busy, that's got all the different subspecialties that you need, that's fantastic. Consider yourself, fortunate, right? And in that, I'll say top 1% of companies that can kind of afford to do so. But a vast majority of the businesses don't have that luxury, and so you need to work with consultants. And I think when you do it well, and that means the consultant as well as the client, right, and anybody else who's involved in working with the consultant, it couldn't be better, right? I think the model is well proven. I think there are some fantastic consultants out there. But I think, I also want to, be balanced in my comments to say, listen, there are times when it's a head scratcher why a consultant is involved. It's a head scratcher as to why that particular consultant is involved. So I think it's really important to, when you're focused on delivering these products for a client, which ultimately is about delivering these products for patients, that the folks who are involved in decision makers are really clear. When value is being added and goals are being achieved, it's the right team. And when that's not happening, changes need to be made. And I think that's an important part of the consultant equation, right? Is sometimes you got to swap them out, and you just can't be kind of tied to the relationship. But I think they're here to stay. I think there's going to be some different balance points moving forward, and I'm very much looking forward to hearing what the other panelists have to say in the Q&A. So thank you very much, Lois.